Fertility centers can be really great at helping to diagnose and test whether there's an underlying reason why couples are having a hard time getting pregnant. Generally, though, they look at what I call downstream effects. So they are testing biological markers to see if there's any physiology that explains what's going on. And then they come up with a name or a diagnosis for that. What they're less effective in doing is coming up with a treatment plan that actually treats the underlying cause of why a couple might be struggling to conceive. And I call this the upstream effects. So in other words, looking at what physiological processes need to be supported to restore optimum functioning of the whole body, including the reproductive system. So for instance, if someone goes to a fertility center and they discover that they have low thyroid, they will not be able to help to actually restore optimum functioning. What they might be able to do is give you a drug that mimics thyroid hormone. It's not the same thing as restoring optimum function. In the same way, if somebody has PCOS, they might be able to give them hormonal agents, in that way sort of mask what's going on underneath. So once they have a diagnosis, what they can do is then use artificial means to help achieve a pregnancy. So this might be IVF or other assisted reproductive technologies, which happen usually in a laboratory, which removes the need for normal functioning physiology. And sometimes this works, and sometimes it doesn't. Because even when it is done artificially in a laboratory, if the underlying physiology isn't working well, that pregnancy may not be supported. And that's why there's usually a 1 in 3 or 1 in 4 chance of success with assisted reproductive techniques in a laboratory. What I like to do with my patients is to look upstream at the root cause of what's going on in the body and then restore optimum functioning. And I do this for both men and women. Once optimum functioning is restored, then often pregnancy can happen naturally. And even in situations where assisted reproductive techniques might be beneficial or needed, or the couple just decide they want to go that route, if we've supported the natural physiology of the body, often they have a much better chance of success and better results from the fertility clinic.